A full-page ad in today's PDN showing a letter to Calvo's Select Care from the Gutierrez-Uggan campaign. It charges that Calvo's Select Care health insurance rates will rise by nearly 300% in the coming year. The letter was written to Calvo's insurance general manager Paul Calvo, but the real target was his brother, Gutierrez's GOP gubernatorial rival, Senator Eddie Calvo.
Obviously, it's political. For them to say this, especially now, when they were a part of the negotiating process, and I'm talking about Frank Uggan, I feel it disingenuous.
I think it's extremely unfortunate that the opposition is going to say, or even representatives from Select Care is going to say that this is politics. This is about the pocketbooks. This is about our people. They're hurting. I've received numerous calls in the last week from family members who have to drop their insurance coverage only because they're not able to afford it.
Senator Frank Uggan Jr. is Gutierrez's running mate and the chairman of the legislature's Health Committee. He stands by the claim that rates will rise nearly 300%.
Nationally, because of the Obamacare provision, we're looking at anywhere from 5 to 12% adjustment in rates. You look at the cost of health care in Guam, why 90% or why 280%? And that the reality is that those are real hard numbers.
Are there any plans that have a 300% increase?
Not a single plan that we're offering today to go Guam increased by 300%. That is completely inaccurate.
Frank Campillo is the Select Care Plan Administrator. This past June, he led Select Care's negotiations with Gov Guam, negotiations that included representatives from various branches of Gov Guam, including the legislature.
I presume that being chairman of the Health Committee, that you would try to find information as to what is going to affect my Gov Guam employees for the next year, especially since the Guam legislature had a representative in that committee.
The difference in conclusions depends upon which numbers you look at. Campillo points to the combined monthly contributions made by both Gov Guam and the Gov Guam employee. For the individual plan, rates will rise from $104 to $182 next year, a 75% increase. For a family plan, from $313 to $533, a 70% increase when both Gov Guam and the individual's premium are factored in. However, Senator Uggan looks to the percentage increase of the premium paid by the individual Gov Guam employee only, leaving out Gov Guam's contribution. In that case, the monthly out-of-pocket premium for an individual rises from nothing now to $10 next year. The family plan from $74.60 to $186 in 2011. The largest increase is for the Class 5 plan, from $45 a month to $175 a month next year, a 287% increase, and that's where the 300% comes from.
Now, we realize that part of the problem is the financial resources that we have today, and hopefully in future years the government of Guam will be able to contribute more on behalf of the employees.
The alternative in this particular case, I think one of the things that we really need to consider is how do we open the market to allow other insurance companies to participate in providing insurance coverage to public employees.
The Select Care contract has not yet been signed. A spokesman for the Attorney General's office, Brian Cruz, states that the contract is being transmitted to the governor's office today for his signature. Open enrollment for the health insurance plan ends on Monday. Kevin Kerrigan, PNC News.